what will happen when someone is in hospital after surgery? So are there processes like having their chest drains removed, managing any DVT, recovering from anaesthetic? What sort of is the general process for people after surgery? How do they get back to being ready and prepared to come home?
So after operation, every patient has a chest drain in place that assures us that every air which is sometimes leaking a little bit from the staple line in a chest is drained to the outside the chest. That if there is any leak, which doesn't happen in every patient, but if there is any, it will eventually stop, usually without any intervention. You just need drain in place to allow it to heal within several days. And also the drain is inside because sometimes after operation there might be a little bit of fluid coming out or a little bleed. So we don't want that to be collected inside the chest, and that's why every patient after chest surgery or lung cancer operation has a chest drain in place. Most of the patient goes home without drain, although if the patients are otherwise absolutely fine and the only things which keeps the patient in hospital is small amount of air coming from the chest drain, then they can have a special bag which will allow the patient to go home with the chest drain as such. And then these patients are usually reviewed every week until we know that there is no air coming out and we know that the lung is fully expanded on a chest X-ray, and then it's safe to remove the chest drain as an outpatient as such. Some people might have an epidural or paravertebral catheter. These are small catheters which are aiming to control the pain or ease the pain after operation, especially after thoracotomies as such, when people have keyhole operation. So that usually stays in place for different amount of days, depend on if it's keyhole or if it's open. But when the patient goes home, they always go home without any of these catheters, and the catheters don't stay longer than up to 1 week. I would say usually about 2 to 4 days, again depending on a type of operation the patient had. Some of the patients might have urinary catheter, but these are mainly for patients who are requiring stay on high dependency unit to monitor their renal functions. And in current era, we are trying to avoid them because again, every sort of catheter or every procedure has small risks. So there's a risk of infection, of urinary infection. So if we can avoid it, which we usually can, when we use keyhole operations, then we don't use them. Sometimes it's patient specific as well. So obviously if the patient has previous problem with prostate or operation on prostate, then we probably use them just to prevent any retention of the urine after surgery. If we believe that there will be some problem with that after surgery, then we usually put it in during the general anesthetics as such. Prevention of complications is important. So in the past, there was a big problem with clots in the legs and lungs, like so-called DVT or deep vein thrombosis or pulmonary embolism. So what we are doing to protect the patient to get these complications is that every patient, unless there is contraindication, has a stockings on their legs, also called intermittent compression device, which is aiming to encourage the flow through the deep veins in the legs to prevent stasis and to prevent clots developing in the legs. They also have a sort of so-called dalteparin, which is a medication which is injection, which is given subcutaneously, and that's a medication which makes the blood a little bit thinner. So again, the risk of clotting is a little bit decreased. And then patient involvement in the form of mobilizing of their legs, even on the bed, or exercising their feet up and down, and early mobilization with physiotherapy is again a very important prevention of developing clots in the legs and lungs. So early after operation, the patient go to recovery, where they are treated by nurses who has only one patient, who is in charge of only one patient. So it's a one-to-one care. And it's basically assuring that the patient is recovering well from the general surgery, general anesthetics as such. They also, apart from the catheters which I mentioned and chest drain, they usually have a PCA, which is so-called patient control analgesia, which is like a button which is connected to a pump, which is a morphine inside. and whenever the patient has a pain, they can press it. So they are actually controlling how much painkillers they are given by this patient control analgesia device. But again, with any medication, there might be some side effects. So it's very important to find the balance. If they don't press it at all, they might experience pain. On the other hand, if they press it too much, then the side effects is usually they might feel sick or actually be sick, or they might be falling asleep. So it's very important for each patient to find the balance to be comfortable, but probably not completely pain-free. Usually the next day after surgery, once we know that they can have oral intake and they can have medications, then it's possible to replace the painkillers which are in a PCA for normal tablets as such. Again, depending on the circumstances of each patient and depending if they had a keyhole operation or if it was larger incision. So if it was larger incision, they might have the PCA a little bit longer. However, if it was keyhole, it probably stays just overnight after the surgery as such.
In terms of, we've talked about on average patients will be kind of getting home from hospital within sort of 5 to 7 days or perhaps a wee bit sooner. Is there anything that someone can do to kind of help? So is it good to get on your feet as soon as possible? How can you help kind of get ready to go home?
In each hospital, there is an aim to implement so-called ERAs, which is basically meaning speeding recovery of the patient, like enhanced recovery, which is aiming for decreasing complications, to allow the patient to be in hospital as least as possible, so they can go home and comfortable and reassured that everything is fine. Once the side effects of general anesthesias are over and the patient is fully awake, which probably takes between 2 and 3 hours in recovery, after that they are moved to normal ward, and yes, they can do immediately something for themselves, the patients. So they can move their feet up and down, they can move your arms up and down. On some occasions I found that exercise like this, when they are moving their shoulders, it sort of helps them to expand their chest as well as moving their arms as such to sort of increase the blood flow. These are very simple things which patients can do immediately once they recover. The same way, taking a deep breath and coughing is very important to prevent chest infection, because after surgery on the lungs, there is always a little bit of irritation of the airways by the tube, as well as a manipulation of the lung, and remaining lung which is not removed might be a little bit bruised and can get infection as such, especially if the patient was smoker until recently. So all these simple things are leading to less complications and active involvement of the patient, which is again very important. So the patient has a very active role in a treatment of themselves actually. As regards mobilization out of bed, so it might vary a little bit hospital to hospital. Again, there is an aim to mobilize patient as soon as possible. So in some hospital where they really sort of stress the importance of advanced recovery, they might be sit up even on a day of surgery. But I would say most commonly they are sit up 1 day after operation. They might start to walk on a spot or do small walking on a ward, especially when they go to toilet as such, because it's much more comfortable than being in a bottle, for example. So they have the confidence that they can do it themselves, and then they can walk. What I usually stress for my patients is that it's not important to walk 5 times around the ward once a day. It's important to walk every hour, just once around the ward. So it's important to do sort of smaller bits and have 10 minutes of intensive sort of exercise or treatment. Do small bits, but do it more frequently and do it as soon as you can after operation.
And one other thing that patients talk to us a bit about is concerns before surgery and as they recover about getting comfortable when they're sleeping. Is there any general advice about, should you avoid sleeping on the side where you've had surgery, or is it better to sleep upright, or is there anything you can do to make sleeping more comfortable?
I don't think there's any need to have any specific position when they are sleeping. Obviously, whenever people have surgery, it's always recommended that they are sitting up. What lung doesn't like, especially early after operations, lying flat, because there's increased risk of collapse part of the lung, which with its implication for chest infection and sort of laborious breathing. I would definitely recommend to use a little bit more pillows, so they are sort of in a slightly elevated position. If they are lying on their back and on the side, I think it purely depends on how much pain they have from their incision. So of course, if the incision is a little bit tender, then avoid lying on that side. However, if the incision is not painful at all, then there is no sort of risk to actually lie on a side of operation as such. There is only one exception, which is when people have a whole lung removed, especially early after surgery. So it is recommended that they are sitting upright as much as possible, and they are lying actually on a side where they had operation, not on the other side. It's just decreasing a certain complication, which is called bronchopleural fistula. They are not encouraged to lie on their healthy side, because firstly they will sort of press the lung which is actually bleeding for them, and secondly they are increasing chance of developing of this complication.